Almost forgot to record. Goodness gracious. I'm glad I remembered. No questions. All right. Okay. So just to kind of recap, last week. So, kind of the old school way of thinking, which unfortunately a lot of people even in healthcare still are kind of in this old school quote unquote mindset of osteoarthritis and joint issues are just wear and tear or a past injury that's just started to cause an arthritic change, and that's just not really up to date thinking, and that's not what the evidence is showing us. So what we're learning and what we know now on the right side of this picture is things that you guys have been learning a lot about. Obviously, I've been talking a lot about metabolic issues, cardiometabolic issues, lipid issues, so cholesterol, triglycerides, LDL. You guys all know what those are. Inflammation in general. This little thing says obesity related inflammation, but I don't like that. It's really any inflammation. Inflammation in general is gonna have its effect on joints and also the muscular system too. So musculoskeletal system. Of course, wear and tear injuries, cumulative force, and things like uric acid. I hope nobody's ever had gout. Oh my gosh, what a terrible thing. So gout is a whole nother deal with uric acid. So anyway, we did go over this slide last time. So just to kind of recap, so you guys are probably sick and tired of hearing me talk about blood sugar and insulin, but it's just that important. So, and I was talking to somebody earlier today. I'm like, man, if I could just have all of you guys wear continuous glucose monitors for a month or two, it really would be pretty eye-opening for a lot of us. Now you can get them, and I've said this before, it's just not cheap. So it's just another thing that, you'd have to invest in. But gosh, I think the company I said it a couple weeks ago, Nutridyne maybe, but one of these companies, I mean, it's like $250 for a month for like a 30-day thing or $300 or something like that. So honestly, it can be very well worth it because if you don't know what your blood sugar levels are doing all day, and you're still having a lot of issues, that can be pretty eye-opening, and it can really the discussion I was having was around, and this is kind of a tangent, guys, but like because blood sugar and insulin are so important, and we've been hitting on it so much. When we talk about things like fasting, should you fast? Should you not fast? I don't know if I've ever really said this on one of these calls, but most people fast from, let's say, like dinner time till the next like mid morning or lunchtime. So it's like an overnight and morning fast. As far as sorry, back up, intermittent fasting would be kind of what I'm talking about. But there is some evidence to show that if you do have insulin issues, blood sugar issues, it's going to be harder, especially culturally for us, to fast more late day through the night. So, more so because you can actually, it's been shown in some of the evidence that you can increase insulin sensitivity, which is a good thing. We want to increase insulin sensitivity. Um, if you're fasting from, say, like 2 p.m. till the next morning. Now, the reason I say that's hard culturally, because a lot of us probably socialize over dinners, maybe family time is over dinners. So it does make it a little harder. But if that's something that you think, man, I could do that, like maybe you don't do sit down dinners or whatever, eating more in the mornings and through the lunch hour, and then doing your intermittent fasting later in the day. So just another idea, just another thing to think about. The evidence is still out there. Like how great that works, it's not going to work for everybody, but it is something you could probably try. And so I digress. So that's just a side note, but tendon structures and cartilage. We talked about this last week, where basically you kind of think about like extra sugars can creep their way into these structures, like tendons and cartilage, and kind of cause them to gum up, for lack of a better way to think about it. So they lose their integrity and their function over time. The higher your blood sugar levels, and if insulin's not working like it should, we just have too much sugar floating around. This sugar kind of goes everywhere. And of course, we've talked about fat cells because a lot of the sugar goes into fat cells. So there's one reason for weight loss resistance right there. is blood sugar and insulin levels. So again, this picture just kind of shows if you've ever had tendonitis, not fun, right? Any other kind of, so gosh, some of the most common areas would be Achilles tendonitis. If you've ever had plantar fasciitis, that is really, really misdiagnosed a lot. I saw this all the time in my clinical practice was people would say they had plantar fasciitis and it wasn't. It was there's a lot of other structures on the bottom of the foot, and some of those tendons can get this kind of damage to them. But anyway, neither here nor there. The bottom of the foot can be an issue. Rotator cuff issues in the shoulders. Of course, your elbows, like you hear golfer's elbow and tennis elbow. Those are and the knees, of course, like patellar tendonitis. These are all areas that this can start happening. So, okay, so if you go let's just say you've had an injury like this or maybe you're struggling with something like this, like of course you should visit a professional like a physical therapist or a chiropractor who does soft tissue work, somebody massage therapist that does really good work, somebody that can work on these things. But then always keep this in the back of your mind. It's like if you're not recovering and improving as quickly as maybe they expect, or and this is for you guys, but this is also just you guys can tell people this kind of stuff, like educate others, because it's like that can be frustrating. It's like, oh my gosh, this tendonitis has been killing me for 6 months and I've been getting it worked on and it won't go away, won't go away, won't go away, and the PT doesn't know why. Well, probably something like this that's underlying it, right? So they're probably needing to check their nutrition, check their, stress and all the things that we always talk about. All right, that's where we stopped last week. So just kind of to continue on, the second thing, again, you guys have seen, most of you guys have seen this kind of stuff, but insulin resistance in general, like this is scratching the surface, but if you just look around this little diagram, like I know quite a few of you can say, yep, got that, got that, got that, got that, or used to have that, used to have that, used to have that, right? So um, it's one of the reasons that I'm just harping on this and preaching this so often and so much because the more we have learned about this kind of stuff, the more it's just become such a high priority in healing the body. Um, yeah, because it just gosh, I think it was Sandy. I think I was talking to you about this, but anyway, I was telling somebody else. I just actually heard this there because I just glanced over and I saw the fatty liver. Okay, fatty liver. There's something called non-alcoholic fatty liver disease, right? So, and then there's other liver issues, liver diseases. And I know you guys have heard me say this over and over and over too, is like the amount of chemical bombardment that we all are experiencing on a daily basis in food and water and products, blah, blah, blah. Like our livers are just overwhelmed. And this study it blew my mind. I honestly couldn't believe it. So the only real way to know if someone has like true liver disease is to biopsy it. Okay, so that doesn't happen very often unless it's like, really, really necessary end stage type stuff. But what they did is they took a group of people, healthy people with no indication of liver issues, they biopsied the livers, and 40% of them had liver disease of some sort, different stages, different types. But it's like that just kind of blew my mind. It's kind of like a wake up call. 40%, almost half of healthy people with no indication. So again, I say that just because that does have to do a lot with this metabolic stuff, insulin, blood sugar, but also all the stressors that we're all under. So keep chipping away at chemical reduction in your life. Okay. So I feel like I'm already off to a great start of a lot of tangents tonight. My goodness. I can't help it. All right. Research has shown that 82% of people with arthritis have an increase in blood insulin concentration, insulin resistance, basically. So that's crazy. That's a good stat right there. 82% of people with osteoarthritis have increased blood insulin levels. So, is that a correlation, causation? You know, doesn't really matter. Chicken and the egg type of deal. It's obviously related in some way, shape, or form, and we're finding out more and more about that as time goes on. So, strategies that can increase insulin sensitivity. So, we talk about this insulin issue, and a lot of you guys have had blood work done, and you know if you have high insulin. Um, Whole food nutrition, of course. Exercise, I've preached this a million times. Resistance training, for sure, resistance training. So, get those leg muscles working, get those leg muscles stronger. Machines, and again, another little tangent here, I can't help it with exercise. Machines are great, right? So machines at a gym that I know a lot of you guys do, like, leg extensions, leg curls, leg presses. Those are great starting ways to get into resistance training because they help stabilize your body. You can kind of hold on to things. But really, I really want you guys to really try, talk to me, talk to someone else that's a professional in this area to make sure you do it safely, to do more free weight or body weight, even type full body movement exercises. So things like lunges, things like squats, things like glute bridges, hip thrusters, those kinds of things. The reason for that, I think you guys, if I say this, you'll probably know what I'm talking about. You've probably heard it before. But when you do full body movements like a squat, like a lunge, you're using a lot more of your body's stabilizer muscles as well as the big muscles. Okay, so that's really really important to especially for joints, right? So for joint health as well, like we're talking about tonight. Of course, there's supplements to help control blood sugar. Berberine is one really common one. Strategies that you guys probably all are aware of, blood sugar control strategies. So move your body after you eat. Try to manage your stress through the day because we know cortisol increases blood sugar, and that's an issue. Eating protein, getting enough protein, and then eating protein before you eat carbs is another easy strategy to do as well. So all things to just as a reminder, because I know I've talked to all of you guys that are on this call about this stuff, just a reminder, say, oh yeah, I forgot to do that or that. So kind of make these habits in your day. Okay. And all of those things are protective against osteoarthritis as well. Number three, cholesterol. So this lipid issue. We've talked a lot about cholesterol in past talks. If you missed those, I'd encourage you to go watch those because cholesterol, there's a lot of myths around cholesterol. And if you know people who have been put on statin medications because of cholesterol issues, you need to go watch that talk, some of those talks that are in your library, because there's a lot of people that are being put on drugs that should not be, and also that are unaware of the consequences of that. And cholesterol is one of those things, LDL, triglycerides, that with proper lifestyle, man, this is totally reversible stuff. So, anyway, I digress. Cholesterol, as far as what we're talking about here with healthy joints, again, research has shown that there's been a heavy link between these really high abnormal levels of like cholesterol and lipids, and then affecting tendon structures and cartilage inside of joints. Okay. So high cholesterol may cause deposits inside joints or in the tendons and ligaments themselves that degrade the matrix. So it's kind of like that, the sugar gums it up that I said. It's kind of the same thing. It destroys the matrix of these tendons and ligaments and cartilage, which drives inflammation, and then it just becomes a vicious cycle. So, when we talk about all things are connected, this is another great example. Like, has anybody ever been to your doctor and they talk to you about, oh, you got arthritis in your knee or your hip or your shoulder or your spine? Do they talk to you about this? No. I mean, I already know the answer to that. The answer is no, because it's just not something that's really out there in the orthopedic world, at this point. At least nothing that I've heard. Maybe there are docs that are talking about this kind of stuff with their patients, but getting your lipids under control, getting your blood sugar and insulin under control can really help the arthritis. Now, I'm going to talk about surgery in a minute because I know some of you guys have even had knee replacements and hip, and that's fine. I'm not saying that's a bad thing, but when it comes to the need to have a surgery, um, one of the requirements that I really truly wished was there was people would have to go through some sort of a program like this before they had surgery, because the outcomes of surgeries are going to be that much better if someone's body is ready to accept the surgery. Does that make sense? So if you have to have a replacement, if you have to have an ACL, replacement, I mean, whatever it may be, surgeries of any kind. And I've actually met with a number of orthopedic surgeons here in Lincoln, and I'll tell you what, guys. Here's the I'm friends with a couple orthopedic surgeons. I've worked alongside them, a few of them over the years. And when I sit down to talk to these, and they were all men, so I say guys because they were all guys. And then a couple of the female like nurse practitioners that work with them. I'll tell you what, not one of them was resistant to what I have to say. The problem is politics. It's like, they could refer someone to me like if they wanted to, and they have done that a little bit. But like to get like because I approached them and I was like, listen, your outcomes would be like so much better if you just because you guys tell people that they need to lose weight before they would replace a knee. Like we hear that all the time. Like, oh, you need to lose 10 or 20 pounds before I'll replace your knee or your hip or whatever. Why aren't they saying like you need to get healthier? You need to get your blood sugars and insulin and this metabolic syndrome you have going on. And really, like I said, long story short is they were all fascinated by what I had to say because I was telling them all of this kind of stuff. And they're like, yeah, makes a lot of sense. Problem is the big wigs probably aren't going to go for it. So it's just another one of those situations that's unfortunate in our system as it is now. So people have to unfortunately kind of search this stuff out for themselves. So again, another long way to say if you guys know people who are going to have a surgery, whether it's me or someone else, just get them help. Just at least tell them, give them a little lovingly nudge saying, hey, you listen, you want this surgery to go well and you don't want to suffer and have bad outcomes. You need to get your body healthy. All right. So again, just more examples. Like there was studies done on the Achilles tendon. There was studies done in the rotator cuff, and all of this stuff affected outcomes of all of these kind of injuries. So okay. Number four. Again, I've talked about inflammation a lot, so I think I'm just going to kind of whiz through this. Other than I guess this is a little different point. So some of the research has also showed that immune system compromise, so if someone does not have a high functioning immune system, that is also heavily involved in arthritis development. And again, that just makes sense because your immune system, part of it is meant to go places around your body and clean things up, right? So if there's a lot of inflammation in your joints, your immune cells need to be able to kind of clean some of that up and get rid of it, right? And that just does not happen if someone doesn't have a high functioning immune system. And as a little review quiz, where does 78 to 80% of your immune system live? You guys know this. You know the answer.
Yeah.
Mm, absolutely. In your gut, your microbiome, your bacteria. So, also why we talk about the gut so much. The immune system obviously is super crucial and important. So, vitamin D3 with K2. Most of you guys are probably already taking that. B vitamins that are methylated is important. Magnesium, different forms of magnesium is I always suggest that because there's so many different types of magnesium that are good for different things. A great multivitamin like the Multi-Active X, it's probably the best multivitamin I've ever seen. Like show me one that has more stuff in it than that one, and I'll be impressed. But probiotics, and again, you guys know there's so many different types of probiotics. We really have to get the right ones in you. Selenium is really important for the immune system. So just as a reminder, if you're not eating a couple Brazil nuts every day, why not go ahead and buy a bag of Brazil nuts and start just two a day, just two a day, one or two a day. Even one will give you 50% of your selenium needs. Okay. Zinc, oysters. I put yum and I should have put like sarcasm. Does anybody like oysters? I've never, no, they're just not, they just, oysters are probably, I think they're the food that's the highest in zinc content, but also beef that's lean and clean. Poultry has a lot of zinc, and then other foods like nuts and beans, they do have zinc in them. But if you don't know this, don't depend on nuts, beans, seeds, things like that for zinc because it's less bioavailable. So you're just not going to get as much. Okay, so if it says, oh, it's got 100% of the daily value of zinc in it, and on like the label of like a nut pack or something, a seed pack, it's probably not, right? So it probably has a lot of zinc in it, but it's not bioavailable forms. So that can be kind of tricky. So again, oysters, beef, poultry, or a zinc supplement if you have to. All right, we talked about oxidative stress a few weeks ago. So again, that's another talk you should go watch if you didn't see it, because it's really important. But that also plays a role in osteoarthritis development, just because of inflammation. So, oh man, so goodness gracious, cytokines. I see that word and it just kind of gives me the chills. Because I mean, what year is it? Is it 2025? When was COVID? Can I say that word? Is that okay? COVID. Did that start in 2020, 2021? I'm like
2020.
2020, okay, and then
Yeah.
it did it kind of like unofficially end 2023, 2022. You guys, my point is like you guys probably all heard this on the news, the cytokine storm. Does anybody remember hearing that? Like with COVID and then also with the COVID vaccination, it's like they showed that it's creating this cytokine storm in our bodies. That's not good because it's basically this inflammatory storm that's happening, which was also leading to a whole lot of other stuff. So if you suffer from, if COVID hits you really hard, if you have long COVID type stuff, like you just never really got over certain things, it's probably because your immune system was not in a great place going into it. And this inflammatory process just kind of like took over everything. Okay. And again, that seems like it's unrelated to our talk tonight, but it really, really is because I had so many patients who, like, after COVID, during COVID, whatever, after they got a vaccination, even, and I'm not here to debate that. That's just not tonight, but, whatever. I'm not going to go there. So, but like joint pain, muscle pain, tendinitises, all the things we're talking about were like so much worse. I don't know if anybody here experienced that, but it wasn't just like respiratory. It wasn't just like that kind of stuff. Like that, it really, and this is why. Okay, so again, just FYI. So let's move on before I start going down a rabbit hole. So, number five, reduced blood flow. Okay, so reduced blood flow is not going to be a good thing, of course. So, like Miss Sandy, the most amazing massage therapist in the entire world, who should be in Lincoln, Nebraska still, so she can see all of her. I'm just kidding, Sandy. I'm just kidding. You're having fun in Pennsylvania. But anyway, massage therapy, all the anything. What am I trying to say? Saunas, exercise, movement, of course, anything that you can do to increase blood flow to muscles and tendons. And it's one of the other things that is like terrible, terrible advice is if you have an injury or an arthritic joint to not move it. It's terrible advice. Terrible because that and the evidence and research has shown this over and over. Now, do you need to like if you have a really bad arthritic knee, should you go like squat down to parallel 100 million repetitions today? No. Like you got to be smart about it. You got to have someone, like I said this last week, someone to help you design a program that's safe but still able to move these things because we have to get blood to these tissues, to the joints. Why is that? Well, because blood brings oxygen, it brings nutrition, vitamins, minerals, all the things that these tissues need to actually be able to have a chance to heal. Okay, so Jimmy Conway, medical doctor, orthopedic surgeon, tendon health and nutrition. I think that's a book he wrote. I never did read it, but basically I took some excerpts from it. Rotator cuff tears are, he calls a heart attack of the shoulder. I don't, that's crazy. That one hit me because I was like, man, that's crazy. Like heart attack of the shoulder. Basically, what he means is through their research, they've shown that this metabolic health, blood sugar, insulin issues, and the lack of blood vessel proper function, like blood flow to an area, is one of the main reasons we see things like rotator cuff tears. Okay. So it's super interesting, super interesting if you think about it like that from this perspective. Okay. I think I already kind of said all this in a way. So how do we improve blood flow? Movement, stretching, yoga, massage, dry brushing. Okay, so that's more of a lymphatic system, right? You're getting the lymph drainage, you're increasing blood flow, but you need to get the crud away from those areas, which is the lymphatic system. So stimulating the lymphatic system via something like dry brushing, Epsom salt baths you could throw in there. And then I talked about sunlight and nitric oxide a few weeks ago. So, direct sunlight on our skin actually produces nitric oxide, which absolutely is helpful for blood vessels. Helps blood vessels dilate, open up, and so more blood can flow. And then, of course, staying hydrated. And I should have in there with electrolytes. So, making sure you're getting the sodium and potassium and other electrolytes that you need. If you have no idea what I'm talking about, you could buy things at every store. Every grocery store has electrolytes now, like packets. I still am just kind of old school. I like using pink Himalayan salt or Celtic sea salt, something like that. Those are really great electrolytes. Just a little sprinkle in my water bottle when I fill it up in the morning. Okay. So easy stuff. You can use fruit, lemon essential oil if you're kind of more like that kind of taste person. Those are great electrolytes too. Oops, too fast. Previous. Okay. If surgeries are necessary, I kind of hit on this. I got ahead of myself a while ago. So let me see if I didn't say anything here. Well, the second bullet point there. So people if they optimize your blood sugar and insulin, surgeries just go better. Post-operative infections go down, hospital stay lengths go down, improvements in wound healing, improvement in recovery time. I mean, all of it's better. It's just better in general. So the third bullet point here, this kind of brings up a whole nother Pandora's box. But there's again, this isn't just me talking, guys. This isn't just my opinion. There's been so many studies on this kind of stuff that there are a lot of surgeries that are very commonly being done that are actually causing more harm than good. And some of the most common surgeries. So, I think I go into that. One of those being the meniscus. So I'm sure somebody, maybe multiple of you in here, have had a meniscus surgery. The meniscus is in the knee. Okay, so if you have, you can't rewind time, no harm, no foul. Maybe they didn't know back then when you had it done what we know now. So again, not trying to do the blame game thing here, but if something like this comes up in the future or someone that you guys know, keep this in mind, this stuff that I'm about ready to say. Okay, so the meniscus is the cushioning between the bones of your knee. So kind of an important structure. So, but in studies, this one study specifically that found patients without osteoarthritis who underwent meniscus surgery had a higher risk of developing osteoarthritis and cartilage loss than those who did not undergo the procedure. Now, there's some statistics out there, and don't quote me on this, but I think there was another study that showed having a meniscus surgery, like a scope, and some of these other things where they cut out part of the meniscus, increases osteoarthritis by tenfold, for example, like the onset of it. It starts happening faster and it's more severe in people who have these kind of surgeries. Now, I'm always going to say this, there is a time and place for everything. If someone has a gnarly meniscus injury and the knee is locked up and they can't move it, or it's like so painful they can't function in life, okay, we might need to go in there and clip some of that out and have a scope done. But this is the kind of procedure it's happening all the time. And there's so much evidence out there that shows that with proper rehabilitation and physical therapy, you actually have better outcomes than surgery in these meniscus tears. Okay, so again, keep that in mind. The outcomes, long-term outcomes of people with the same type of injuries in their knees with the meniscus show better outcomes over the long run than people who actually go through with the surgery. And one of the reasons is because now we know that that type of surgery increases the rate of the arthritic kind of vicious cycle. Okay, so just FYI. I think I said all of that. So there's let's just skip. Okay. Let's talk a little bit about MRIs. Okay. Uh MRIs, I actually thought about being a radiologist at one point in my career because I loved looking at imaging. I loved X-ray analysis. I loved MRI, ultrasound, all of it. And so, like, anytime a patient had an MRI, I would send people for MRIs. I would be studying that stuff. And then the research that comes with it. And here's the crazy part. This is talking about the meniscus, right? So again, the knee. One study showed that 61% of people with incidental meniscus tears on MRI had no pain. Okay, so like we do MRIs on healthy knees, is basically what this is saying. And 61% of healthy, asymptomatic, no pain knees still had meniscus tears in them. Okay, so if we're depending on just an MRI to say, oh, you need surgery, that is a very, very poor way to do it. Okay. Now, my specialty, I did sports injury stuff, so I had to work with every joint in the body. So I did a lot of work with knees and shoulders and elbows and all things. But like the spine. Here's another crazy thing. If you take, I always told people this in my office because my practice used to be right on Old Cheney, pretty busy road. So I'm like, I'm going to go outside, and if I pull the first 10 cars over and say, and I only accept people with zero low back pain, okay, and I say, okay, can I put you in an MRI machine? 60 to 80% of them will have lumbar disc herniations or bulges that don't have any pain. Okay, you guys getting my point here? So it's like you can't depend on even imaging with this stuff. So if a surgeon sees that, oh man, you got this disc bulge, this disc herniation, what's the first thing that they're probably going to tell you? Well, we need to go cut that out. But it's not painful. It's not even creating any symptoms. So again, my point is there's a lot more that goes into this stuff. So just be your own advocate. Make sure you know the facts before you just, trust everybody in what they say. Okay, anyway, moving on because we're wrapping up here, almost done. Um, Talking kind of hit on this earlier. So movement and arthritis. So Dr. Lux is another medical doctor, orthopedic type guy who says exercise is one of the most effective treatments for early to moderate osteoarthritis. So that the idea that exercising would further worsen the joint is a fallacy. He explains that exercise has anti-inflammatory benefits. So anyway, gotta exercise. Okay. Whoops. Wow. What just happened? I think I accidentally clicked on a link on that slide. Uh-oh. How am I going to get this back? There we go. Okay. And then we've talked about this as well, but just to reiterate, muscle, right? Using those big muscles are so important. So keep working the body. And I think I've beat that to death. So last but not least, I know all of you guys weren't around when Dr. Jamie Dodge was a guest. That was, gosh, that probably was last fall, summer. I don't even know how long ago that was, but stem cells. So, stem cells are always something I just got to mention them because people hear about this and ask me this question all the time. If I have joint issues, should I get stem cell injections? They can work very well, of course. Yeah, that's definitely a possibility. But they're really expensive, really, really expensive. And oftentimes insurance isn't going to cover it. So what doctor and stem cells, again, if you don't know, they can basically, they're immature cells that can turn into like any cell in your body. So they can mature into any cell. So they can repair cartilage and tendons and ligaments and muscle cells and all that kind of stuff. So what he presented on a few months ago was he's been using these little infrared, not infrared, I'm trying to think of. They're just little patches that you wear on your body. It's a company called LifeWave that it's pretty amazing. The research that they've done is that can actually stimulate stem cell growth, maturation, and I actually have seen a lot of benefits with my knee. I have a bad knee from an old football injury. I've done really good taking care of it, but it's kind of one of those things it's gonna kind of wear out over time, just the way that it is. And I've seen some benefits with that. So if you guys are interested in things like this because you have issues like that, um, then you can talk to me or you could get a hold of Dr. Dodge at his office as well. So anyway, I think that's it. Do you guys have questions? That'll kind of wrap up this topic with, arthritis and joint pain and all that kind of good stuff. So I'm ready to move on to a different topic. How about you guys? Hopefully you learned something as usual. You guys if you have any questions, shout them out. And as always, if you guys have any topics that you want me to hit on, please shout them out or send me a message or something. All righty. Anybody have anything tonight? Okay. I see a lot of no's. All right, y'all. Well, stay warm. Tucker, what's it like in Texas?
It's like mid 20s.
Oh,
It's
it's
pretty cold.
too.
Yeah, yeah.
What's the temp in Arizona? I don't know. I'm trying to read your lips because you're muted. Did you say 47? Anyway, it's cold here, so everybody stay warm. We'll see you guys later. Have a great rest of your week. Bye bye.
All right. Bye.